This is Fox 21 Morning News, your all-local, all-morning newscast. Fox 21 Morning News.
Well, are you one of the millions of Americans who struggle with missing teeth and the public complications that come from them? Well, this morning, you may have reason to smile. There's a new procedure on the market that can have you in and out and grinning from ear to ear. With more, please say hello to Dr. Paulo Malo, inventor of the new All-on-4 technique, and Dr. Stephen Moss from the American Board of Oral and Maxillofacial Surgery. Am I saying that right?
You are.
It is a mouthful. Good morning to you both. Let's start with you, Dr. Moss. How has the dental industry typically dealt with patients who are in need of replacement teeth, like dentures, bridges, that sort of stuff?
Yeah, well, that's exactly right, Tim. Dentures, as you know, have been around since the days of George Washington. They've come a little bit further. Now they're made out of acrylic instead of wood, but they still slip around and can fall out of your mouth while you're eating and speaking, and so they can cause social embarrassment, and they are not very effective as tools for chewing. So next would be dental implants, which would help you to replace teeth that are no longer removable. But the problem historically has been, as we lose our teeth, we lose the bone that holds the roots, and because there's not enough bone volume, it's very difficult to put dental implants in patients who've lost all their teeth. That is until Dr. Malo came up with quite an innovative technique based on placing these implants at different angles to maximize the bone that is available.
Well, you're setting them up like we're playing volleyball. Dr. Malo, how did you come up with this procedure? How does it work?
Well, basically, it all started about 1990 when we were confronted with a huge amount of people without teeth and without bone. So we did a little research around the world, and we found out that 40% of the world population in civilized countries above 65 years old did not have teeth. Now, as Dr. Moss explained, if you don't have teeth, you don't have bone, and you cannot place implants. So these people were stuck with these dentures, which is not really quality of life. And the only way we could solve this problem was by doing bone graftings. Okay. Now, bone graftings in older people, and especially people with the diabetes and other systemic problems or osteoporosis, is not, the success rate is really very low. So we needed to shortcut here and avoid bone transplants or bone grafting. So that's what we did. We did something called the All-on-4, and this was a major breakthrough. It today is known as the most important breakthrough in the last 40 years of our. Basically, to understand, Tim, is this. Number one, there's no need for bone grafting in any case. The success rate comes from 40 to 50% to 100% on this new technique.
Wow.
The price goes almost to half of the price, and the procedures can be done in less than 1 hour. So all this together made this procedure what it is today, known as the most important procedure in terms of breakthrough in oral rehabilitation.
Well, that's what I find so interesting. I mean, you say this can all be done in one day. You can come in with no teeth and walk out with a full mouth. I think that's amazing.
Absolutely, and more than that, it can actually be done in less than 1 hour if we use the computer-guided surgery. So it can be done in less than 1 hour, or it can be done in 4 or 5 hours. Either case, the surgery itself is very fast. It's always about 30 to 45 minutes. It's the placement of the teeth that, if you use the computer, can be done in 10 or 5 minutes. If you don't use the computer, it takes about 2 to 3 hours, where the patient actually waits until the teeth are fabricated.
We're almost out of time, but real quick, is everybody a candidate? Is there anybody that is not a candidate for this type of surgery?
Tim, virtually everybody's a candidate because we no longer consider things like how much bone do you have, or if you're very sickly, you can't have general anesthesia, so you can't have bone grafting because you need to be completely asleep for it. But with this technique, it could be done with local anesthesia, or what's commonly known as just Novocaine, right in the dental chair. So we're able to do this procedure regardless of age, regardless of how healthy you are. So almost everybody is a candidate, yes.
It's great what technology can do today, isn't it? Making people smile.
Absolutely.
Dr. Malo and Dr. Moss, thanks for stopping by this morning. Give us a website we can go if we can want to learn more.
Yeah, that's www.malodentalimplants.com. That's MALO dentalimplants.com.
Great. Thanks. Have a great day.
Thank you
for having us.